Thank you. Well, thank you everyone for coming today, and to SWAN for inviting me to speak. So like Linda mentioned, I'm a genetic counsellor currently working at GENE, which is genetics in the northeast, based out of the Austin Hospital mainly, but also working out towards the Northern Hospital regions as well. So before my master's training, I previously came from a science background, doing an undergraduate degree majoring in genetics. And it was during this time that I really discovered that how much I love the science of genetics, but I also knew that I really loved working with people. And so from this, I came across genetic counselling, and it seemed like the perfect profession to bring these two things together for me. So today I've been asked to talk a little bit about genetic counselling and what we do, and particularly what is genetic counselling as well. Like Linda mentioned as well, I've been a member of the SWAN board since about 2016, discovering SWAN through my master's degree. And I feel that being part of the SWAN board has given me invaluable insight into the lived experiences of families I work with, and in particular, the challenges that parents and families face when navigating the diagnostic odyssey, and the importance of peer support for SWAN families as well. So to begin with, I thought I'd provide some background into the clinical genetic workforce in Australia. There has been a recent census undertaken that estimated that the clinical genetic workforce comprises of approximately 630 individuals. And so this includes genetic counsellors and clinical geneticists. Within this workforce, there are approximately 480 people with a genetic counselling qualification. And these individuals work across a variety of roles, including laboratory-based roles, research or university-based roles as well as clinical genetics roles in public or private genetic services. And so of those with a genetic counselling qualification, there are approximately 220 clinical genetic counsellors. So that's genetic counsellors working in clinical genetic services. So I think Sue White and David Amor touched on this a bit earlier, but really the process for a referral to genetic service is the referral is arranged for a patient from a GP or specialist, depending on the indication for the referral. Patients can initiate referrals and they can talk to their specialist or their GP about a referral. It obviously does depend on the different indications. Typically, referrals will ask a specific genetic question. So for example, what is the chance of this couple having a child with a specific genetic condition? The referrals are then processed by the genetic service, and they're triaged to assess the urgency and determine the appropriate appointment type for the patient and family. And then depending on the indication for a referral, an appointment may be offered with a genetic counsellor or clinical geneticist. Now, obviously, this process varies very much across different services and different areas of genetics as well. If a patient is offered an appointment with a genetic counsellor versus a clinical geneticist, it will really depend on what the indication is. So if the patient requires a clinical examination, then to begin with, it's highly likely that they will first be offered an appointment with a clinical geneticist. So next I thought I'd cover where can you find a genetic counsellor, what areas do we work in, and who may see a genetic counsellor, and then ultimately what is genetic counselling, and use a case example to demonstrate this. So the majority of genetic counsellors are based in the public health setting, and there are also some genetic counsellors that may work in the private setting as well. So we work in multidisciplinary teams depending on the service. For example, at Austin Health, we work in a team of genetic counsellors, clinical geneticists, medical oncologists, and other specialists, including nephrologists and cardiologists. And there are some useful online resources to help individuals locate their nearest genetic service or genetic counsellor. So as genetic counsellors and clinical geneticists as well, we work across a wide range of different areas of genetics. So we have cancer genetics, general genetics, which encompasses paediatrics as well, renal, cardiac, prenatal, and neurogenetics as well. And different services will have different focuses. Some services might be more focused particularly on cancer genetics, like the services in Parkville, whereas others may be more general-based services as well. So I guess that then leads me to who may see a genetic counsellor. And really, it's an individual with a personal history of a medical condition that may be due to an underlying genetic cause. It An individual with a family history of a medical condition who may want to understand their chance of developing that condition. Or it's also a couple who may seek reproductive information as to the chances of passing on a genetic condition or having a child with a genetic condition. So that then leads me to, well, what is genetic counselling? So the definition of genetic counselling is really that it's a process to help individuals understand and adapt to the medical, psychological and familial implications of the genetic contribution to disease and other specific health conditions. So to illustrate what is genetic counselling, what I thought we might do today is go through a case example and talk about what role a genetic counsellor might play in this sort of case. So this case is a case of a 6-year-old child who has moderate intellectual disability, autism, short stature, and some distinctive facial features. The family previously attended a genetics appointment with a clinical geneticist at 4 years of age. And at this time, they had some initial genetic testing arranged in the form of a microarray and Fragile X testing. And so you would have heard David and Sue talk about that earlier. So the Fragile X and microarray testing were normal, and the family returned to clinic to discuss the options for the genetic testing. So the appointment is an appointment to discuss consenting for whole exome sequencing, and in this case we're talking about singleton or exome sequencing just for the child. So the role of the genetic counsellor in this case is really to update the medical and family history. They'll discuss whole exome sequencing, the testing process, possible outcomes and implications for the child and family. They'll provide information about relevant genetic concepts to assist in the family's understanding. They may address family concerns regarding genetic testing or the possible outcomes. And they'll provide support and counselling to promote informed decision making, which may include exploring how the family may adapt and respond to a genetic diagnosis. So the family provides consent to go ahead with whole exome sequencing, and a pathogenic mutation in the ANKRD11 gene is identified. And this provides the child with a diagnosis of KBG syndrome. So in these cases, these initial appointments for these results may be with a geneticist, depending on the results, or they may be with a genetic counsellor, they may be together, or a family may be referred to see a genetic counsellor at a later time to talk through this as well. So the role of a genetic counsellor in this case would be to discuss the testing results, provide information about inheritance patterns and chances for future pregnancies, as well as what reproductive options might be available for the family should they be interested. They'll explore how the family may adjust to the diagnosis, and they'll provide psychosocial support for the family as well. And they'll also provide the family information about relevant support groups and resources that might be available to them, such as SWAN. So I guess if we look at the position of many SWAN families who might undergo exome sequencing where a diagnosis isn't found, then the role of the genetic counsellor will shift slightly, and it will be really about supporting the family through this information and how they might respond to this information and living without a diagnosis. So really, when we think about genetic counsellors and clinical geneticists, whilst we have an overlap in the areas of our skill set and we work very closely with one another, what really sets us apart as genetic counsellors is our expertise in counselling skills, decision making and adjustment to a diagnosis or risk. Particularly, our role is focusing on helping patients through a process where they learn to live with genetic information we provide and taking a patient-centred approach that we're guided by the needs of our patients. So to conclude, in summary, genetic counselling integrates the interpretation of family and medical histories to assess the chance of a condition occurring or reoccurring, education about a specific condition, inheritance, testing, management, prevention, support resources and research, counselling to promote informed decision making, and in this case we want to take into consideration the chance of a condition occurring, the family goals, the ethical and religious values of that family as well. And our role is in providing support to encourage adjustment to a condition in an affected individual or family or the chance of that condition occurring. Thank you. I'm happy to take any questions. I think that one or two, Linda, if we have time. Yep.
In your role, you obviously don't just need to deliver difficult information to a family about their child and about the ongoing sort of needs potentially with that child, but also perhaps to some of the other family members that are in the room. And I wondered, as a genetic counsellor, do you have the capacity for ongoing support, whether that is informational support or some emotional counselling type support for the whole family, or are you able to refer on to other services, and if so, which ones do you refer to?
Yeah, so that's a really good question, a really good point, Linda. So I guess, you know, what we're thinking about in genetic counselling is genetics is family information a lot of the time. So if it is a condition that's inherited, then it is relevant for other family members as well. And obviously there are sort of psychosocial things that come along with that if a condition has been passed on from parents as well. So our role in genetic counselling is to assist in that adjustment for that period. Unfortunately, in terms of resources, you know, we're not a profession that has lots of resources. Like I said, there's only about 220 of us working in Australia currently. Our ideal situation, and what a lot of us do with our own families, is we will follow them up at least once or twice after that with a follow-up phone call. And if they do require more input from genetics, then see them again. But we also are really good advocates for our patients in connecting them to other support networks and support resources. I know we use SWAN quite a bit at the Austin Hospital as a way for families to, you know, get that peer support and other support that they might need as well. Hopefully that answers that.
What happens if a couple or a person is diagnosed as a carrier and they are uncomfortable or don't want to share that information with other family members, even though those other family members may be impacted?
A really good question, and part of our role is really about family communication and trying to unpack that with an individual in the room. What reasons and what are they thinking about in terms of why they might not want to share this with their family members, but also telling them that it's actually okay. You know, we're not there to tell them they have to share this with their family members. We can't force people to do things, and really our approach really is non-directive with our patients. We're not going to tell them what to do. But I think, you know, we can talk to them about other ways that they might want to communicate that information. I know in the cancer genetic setting, it's a very big thing, family communication. And we do have like anonymised family letters that don't actually mention anything about the individual themselves. It just says that this has been identified in your family, and if the individual is to pass that on, or to pass that on to other relatives that may be able to assist with that information. Obviously, we do spend a lot of time talking with people through that decision making and why they might be leaning one way or the other way. Yeah. Thank you.
Thanks, Rhiana.